Our next session is about saving lives peer naloxone distribution, and we've got three people from SDF. We've got Wez Steele, who's worked in residential treatment centres and research projects and rapid access homeless hostel, and he's keen to raise the profile of living and lived experience voices within policy and practice settings, which he's done. Secondly is KerryAnn Colquhoun, as part of the drug deaths prevention team at SDF, and we've also got Emir Taha.
Peer naloxone supply, so saving lives across Scotland. The other speakers will just introduce themselves as they come up because we are quite short on time. But why a peer supply? So we know that opiates do dominate drug use deaths in Scotland. Unfortunately, they have done so for decades now. And peers, in my opinion, have privileged access, so they can go places that conventional professionals can't even actually really go. They have an increased reach into at-risk communities, and they often have instant credibility with the people that we most want to ensure have got a naloxone kit available to them. One of the speakers earlier was talking about the poor levels of people engaged or even known to treatment services in Scotland, so just under 40%, I believe, so 60% of people with problem substance use aren't known to a service, so they're probably not routinely being offered naloxone provision. So yeah, the people within the most at-risk communities of people with problem drug use, making them really well placed to improve naloxone provision across Scotland. A quick note about the project. So we were funded by the Scottish Drug Deaths Task Force, and we appreciate that funding. Initially, it was 2 years funded for just one post, and then KerryAnn joined to expand the project to another 3 sites. We had 3 key objectives: to establish, embed, and support high-quality peer naloxone supply as a core service across Scotland, and to ensure those involved in the peer supply had an active voice in service provision and delivery, hopefully encouraging people along to locality strategic meetings, drug death prevention meetings or harm reduction meetings, whatever the most appropriate format in the area. And for SDF to connect with and offer support to all peer naloxone projects across Scotland, so any that weren't actually receiving financial support from the funding, and we would just offer support. That could be training, supporting events, and creation of a national network, which KerryAnn will speak to a wee bit later. So a quick slide on some of the progress to date. All the areas faced significant challenges in setting up the projects. We had to initiate steering groups, working with multiple different partners across the different local health authorities. So we didn't have a clear start date for all the kind of first wave projects, so to speak. They've all kind of started at slightly different times. But Dundee was certainly the quickest off the mark, and we're very lucky to have Emir come and join us, who's worked up in Dundee on the project. And some of the highlights up there: 36% of all the Dundee supplies 21 to 22 were made by the group of 5 peers. So 5 peers in Dundee city centre made actually 36% of all the supplies that went out from all statutory and non-statutory services, and all the peers, crucially, were paid for their expertise and their skills and their time. I wouldn't be turning up for free. I wouldn't be turning up for Tesco's vouchers. So then moving on to the borders, we faced some recruitment struggles down in the borders, but we did have some success with involvement at the ADP harm reduction meeting, and a national organisation created a specific job role that is now transferable to other areas as well. So some really early learning and successes. And then Glasgow prisons. So it's a groundbreaking project. It is the first time, to my understanding, that someone living in a prison is able to train and supply a prescription-only medication to somebody else living in a prison the night before liberation. We know naloxone provision from prisons is sketchy at times. People often might not want to disclose substance use to a member of staff. I do think routinely anyone in receipt of OST or known to addiction services would get offered. But again, if they're being offered at reception in front of their peer group, they might not want to be taking that kit. They might not want to be hanging about, being trained by another resident on the hall the day before liberation. I really can't shout about that aspect of the project enough. And that's also now expanded to Low Moss. That expanded to Low Moss in March of 2022. So then Forth Valley. Forth Valley launched in January. That's another community service, and that's based in a non-drug treatment service, which is again a new bit of learning for us kind of going forward. Highland launched in May. the peers in Highland are offered fixed-term contracts, and they're based out of a homelessness service, so temporary accommodation service. Again, so a different approach and more learning for us kind of centrally. Fife, the launch is imminent, and that's based in a harm reduction service. I'm really excited about some of the work they're already doing, shadowing the coordinator. And then we've got HMP Edinburgh, which has just launched in August, and we've actually partnered directly with SPS colleagues. And again, I think that's going to be a really quite innovative approach. In the Glasgow prisons, we partnered with the Health Improvement Service. We held a naloxone drive where we trained 311 residents with an opt-out model, so everybody would have a kit put into their property unless they specifically told us they didn't want a kit. So we're adopting that opt-out approach. Castle Huntly, we're just awaiting some of the framework to be approved, and we will be looking to launch up there. And then Dumfries and Galloway will be our final community project. The peer role is currently live at the moment, and we're hoping to recruit very shortly. So just a very whistle-stop kind of tour of some of the overview of the sites we're working on. So putting the work in. So I love these pictures. I love especially, I think, the one down the bottom with the two chaps with their back to the camera, because that's actually in a hub in Bellini Prison. And they're able to just raise that awareness with other residents in a kind of more community-based setting. And yeah, just getting out and raising that awareness, helping to reduce stigma also, just having those conversations. We really welcomed the national campaign. Many more people were coming forward to ask about naloxone and get a kit, because I think now people know they can help reduce drug deaths, whereas before I think they thought it was just for services, just for professionals or clinicians to be doing. So some of the numbers, 1,766 kits to date, of which well over 1,000 were first supply. So the first time anyone had actually been given a naloxone supply. And with that, I am going to pass on to my wonderful colleague, KerryAnn Colquhoun. Sorry, just my last point, 2,000 plus paid hours. You don't get out of it that easy, KerryAnn. There you go. Thank you very much.
Thanks, Kirsten, for asking me to come here today. For those of you who I haven't met, David, thank you for saying my second name correctly. Usually people don't say my second name in the right way. So I used to be part of the drug death prevention scheme with SDF, but I moved on 3 weeks ago, so I moved on to a new role. So it's really, really nice to be here. And can I talk about now the work that I was doing when I was involved with the SDF? And Wesley said to me yesterday, you've got 5 minutes, and I'm like, 5 minutes, really? And then Jason's on before, and I'm like, Jason's such a good speaker. How do you not put him on after us, Kirsten? But I'm here to speak about now myself and Wez. Now, we set up the very first ever national peer naloxone network. And what that done was that kind of brought peers from all over Scotland, from our online platform, to come together and to share now the kind of work that they've been doing within their area. It gave them a safe space to come and kind of talk about many supplies that have been given out, any barriers, the kind of facilitators that they had kind of come up against. And it was absolutely amazing, I must say. Now, my year working with the SDF, that was one of my kind of favourite meetings now to go to and attend, and myself and Wez would be absolutely buzzing now after it. And we didn't have any opinion on that kind of meeting. It was the peers and how they ran it. It was their kind of views and what they wanted, and a lot of them had asked for like bite-sized training. So we got quite a few. Now we had Jim Thompson from the Simon community come along to share on the VCU project, and with Matt Smith, he came to the first ever one and kind of shared the evaluation of the peer project that got done back in 2017. Is that the right date, Matt? Aye. And then we had a few other kind of trainers as well. We also had held a national peer coordinators meeting. I always say that wrong as well because it's all national peer. And that the coordinators from all over the areas across Scotland that were kind of doing like supervision and stuff for the peers, that gave them the opportunity to come. And we had a lot of good coordinators from the areas. So far we've had 4 meetings. We have them every 12 weeks. And you don't just have to be involved in the peer naloxone with the SDF. If you're involved in any sort of peer naloxone across Scotland, now you can come along and kind of have your input. We also created a national Teams channel. I'm sure a lot of you are using Teams. It is hard work at times, but there's 150 participants now that kind of attend that. You either love Teams or you absolutely despise it. So it was a really good opportunity, as I say now, for all the peers to kind of come together, and it gave them that kind of safe space. So kind of like any project now, there's been kind of some barriers and facilitators, and one of the kind of biggest barriers that we come up against was in my opinion, no, not even my opinion, in my experience of working the project for the past year, is Scotland are really, they're very reluctant in how to employ peers with living experience, so ones who are currently using substances or ones who are prescribed OST, which is really, really sad now, because they've got so much value as a person who is now like, abstinent. PVG, now there was a long, long wait for PVGs, and that was one of the biggest barriers as well. So peers, we would go through all the full process of the recruitment, they would get allocated a job, and then it would take a while now for like the PVGs, and by that time they had lost their momentum. And the benefits as well, a lot of peers think that they can't take on session work because it will affect their benefits and they'll need to start paying rent and stuff. So that was kind of one of the barriers. And then the short-term funding. Now, obviously, the project was only funded for a year, initial year, and then it got another 12 months funded. And then digital access. Now, a lot of peers, what I will say is the coordinators from some of the areas were really, really good in regards to literacy. Peers that had kind of come on board, and they weren't really used to like opening computers or even doing anything with computers. So the coordinators and also myself and Wez now gave quite a bit of support around that. A lot of facilitators now, the role was really widely advertised. Now myself and Wez, I don't know how many presentations we've done like within each locality now within the ADP meetings and stuff, and so was the services. Now they were really, really good. We would hold like a recruitment day, so it wouldn't be, so peers could just turn up and we would support them in doing the application and stuff as well, and we would kind of walk them through the full process. And then the hybrid, now remote working, as we all know now, like the past couple of years it's been quite, with COVID and stuff, meanwhile we loved getting out. We kind of hated sitting in the house and on a computer, but it had to be done sometimes. But we gave quite a lot of support on how to the peers. And then the digital training support as well, as I say now, we done like recap sessions after we delivered the training for training sessions. We went up monthly and done recap sessions with the peers and gave them a lot of support, and also the coordinators from each of the areas now gave a lot of support to the peers as well. So I'll just move on, so I've only got 5 minutes. So myself and Wez always say that the sky's the limit, we kind of named this slide, and we believe that in the future it shouldn't just be peer naloxone paid. Now, peer workers, but they should be delivering IEP, they should be doing dry spot blood testing, they should be doing all sorts of harm reduction interventions. And the reason we're strongly on that is because the feedback that we've got now for other peers is they've got that instant credibility. And Wez spoke about the prison. Now, we get feedback for the health improvement team for the prison saying that there has been a massive uptake in Nixoid kits getting taken for prisoners, like double the amount than what they would from the health improvement team. That isn't to speak about the health improvement team, but there's the credibility of a peer now going to their cells and offering them it and give them a Nixoid there and then. And I believe that would be the same now with all kind of harm reduction interventions. So I think that's me, and I will just pass you over to Emir, who's going to speak about being a peer.
Hello. I'm going to be a bit different, to be honest. I wish this was on Teams because I wouldn't have to look you all in the eye. I could just stick my camera off. I'm absolutely buzzing to be here, if I'm honest, and I'm totally blessed to be standing in front of you. Just to give you an idea, if I rewind back 3.5 years ago, I was at the darkest point of my life. I'd had a succession of the downward spiral. I was jumping from job to job before I got sacked, so that I thought that manager was terrible, this manager, it was all me, and that took me to my lowest point, and that's where my journey began. And that's the man that you see before you today is a completely different person from the boy that walked into a rehab in a man's body. So that's why I'm so blessed to be here, and this means so much. I went into a residential rehab in Jericho 2019 to repair myself, to build myself, and I started volunteering at Hillcrest after 6 months. It's where I met the fantastic team, and then I continued to volunteer there for a year, and then I got pulled aside one day by the manager, not just my line manager, the big boss, And I thought, oh, what have I done? Fortunately, it was about this amazing partnership that I had with SDF, and there was an opportunity to roll out the peer naloxone programme in Dundee. I jumped at the opportunity, and that's where I met Wez. Sorry, I was waiting to call you Wez. I've only known you for over a year. Yeah. And from there, just the fact that someone had thought I was good enough to give me that opportunity was, my confidence was building anyway, but someone believing in me, and you know, it was a part-time role, it was Monday, it was 6.5 hours, and it just started building my confidence, and I felt, I don't know, for the first time in a year as I started becoming accountable, the money was good, obviously. That's why it's the thumbs up. Much better than the vouchers. And I was actually able to provide for my kids, which is something I hadn't done for about a year and a half. So also the other bonus was that I could buy work t-shirts from Primani, so I was all rigged up. It was pretty good. Like I say, when I first started in the team, being paid, there wasn't much of a difference apart from me and myself in my head, and being someone that suffers with addiction, that was a stigma I had in my head. And so when I was finally on a level playing field the way I saw it, it gave me the courage to say that perhaps we should do this, or what about this is a good idea. And it was well received by the team. I did make mistakes because I'm only human, but the thing was I wasn't being micromanaged. It was giving me the chance to build myself and find out what worked and what didn't work. And the beauty was, because I'm going into hostels, because I'm going into churches, because I'm going into shopping centres, I was a presence, and that started breaking the stigma there. So that really benefited me as well. From there, I'm really pleased to say, as of tomorrow, I celebrate my first year in full-time employment. I've came full circle. Jericho House believed in me too. They saw the work that I was doing with Hillcrest and SDF, and I'm now a support worker there and activities coordinator. I've changed the service. I've made it much more of a holistic service, I feel, in helping people individually for their needs. It's not like what's been said before. It's not a one-size-fits-all. There's space and wriggle room for people. It's got to be down to them. Again, sorry, going back to the peer naloxone, I'm so blessed that between the 5 of us we rolled out 872 kits in Dundee from April 21 to June 22, and that for me is not bad. I'm pretty chuffed at that as well. That's what I've got to say on my opportunities about embedding in the team and being paid. I just like to say that, you know what, there's a lot of power in the room today. There's a lot of positivity. There's been a lot of talk about people in power. And that's great. It's great positive chat. But I really hope that every single one of us that can make a difference, go out of here today and follow through with this. And I honestly believe, just my personal opinion, that it doesn't have to come from the top down. We really need from grassroots and work ourselves up, because the way it's worked for decades hasn't worked. And I feel that we've got a real shift in momentum, and I hope we carry on and seize this moment. I'd just like to say a massive thank you to Wez for being a massive support, and KerryAnn, and also my Hillcrest team. And where would it be without Eddie? Eddie is the kingpin of peer naloxone, so I've learned everything, including how to present, from Eddie. So it's been a pleasure being in front of you. Thank you so much.